How many liposuction procedures would you need to treat lipedema surgically? In this video, you're gonna find out. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. Today, I wanted to talk to you about staging of lipedema procedures. As we know, one of the main surgical treatments for lipedema is a liposuction procedure. But the question I frequently get asked is, how many procedures would I need to address lipedema in my body in the lower extremities? And the answer is, it all depends. Let's talk why staging is necessary. Why can't it all be done at once? Well, as we know, with the liposuction procedure, you can cause major fluid shifts in the body. Most of the time, majority of the plastic surgeons will perform what's called tumescent liposuction procedure, where a solution is injected under the skin into the subcutaneous fat or lipedema fat. The solution most frequently contains epinephrine or adrenaline to shrink the vessels to minimize the blood loss, and lidocaine for pain control. So when too much of that solution is injected into the body, that can cause electrolyte abnormalities and volume overload, which can be hard on your heart. Volume depletion is another problem, where too much fat is harvested at once, can resist some blood loss during the procedure, and too much blood loss can result in complications. Also, it was shown in multiple studies when the volume of the liposuction exceeds 4 or 5 liters, the chance of complications goes up drastically. Infection, again, blood loss, electrolyte abnormalities, congestive heart failure, etc., blood clots in the legs. So majority of the surgeons prefer to stage the procedures for lipedema to minimize those complications. Can it be all done at once? In rare instances, it is possible. Most of the time, this requires general anesthesia and the stay in the hospitals. Majority of my patients will actually prefer outpatient procedure. They like to sleep in their own bed, go home the same day. And they also appreciate the possibility of awake procedure, not going under, not getting general anesthesia. Procedure is usually very well tolerated, and it offers a lot of benefits in terms of the recovery. So how many procedures would you need? As I said, it all depends on the severity of your lipedema and the volume of the liposuction that's necessary to address the lipedema. Some patients mostly experience the symptoms in the lower legs and the knee area. A lot of patients experience symptoms in the upper legs as well, in the thigh area. Patients sometimes experience symptoms in the arms and the lower abdomen. In this instance, you will need additional procedures to address those additional areas. If it's just the lower legs, usually one treatment can be sufficient unless it's very severe advanced case of lipedema. In various states in the United States, there are limits on the volume of the liposuction. Can be performed at once as an outpatient procedure. For example, in the state of Florida, it's 4 liters. California, some states in the Midwest, that's 5 liters. The staging of the procedures also depends on your overall health, fitness level, and associated medical conditions. If you're anemic, obviously you're higher risk to lose more blood, and you will not tolerate losing significant amount of volume in the body. Then the procedures needs to be staged apart, a little bit further away from each other. If you have diabetes, puts you at a higher risk for delayed wound healing and infection, which is actually extremely rare for the liposuction procedures. If you have certain heart conditions, congestive heart failure, certain congenital anomalies in the heart, this will make liposuction procedure more challenging. So how we frequently stage the procedures? Well, commonly, if the patient reports that her lower legs bother her the most, we usually start with that area. So lower leg area, calves, cankles. Sometimes we include the area around the knee. I perform 360 liposuction of the lower legs, so usually that puts us close to the limit in one procedure. If the patient wants to address her thighs, that can be done first or as a second procedure. Thighs frequently require more than one procedure, especially if we do liposuction of the thigh 360. If we go all around, thighs usually have a lot of fat. And again, it varies drastically from patient to patient, but thighs can have significant amount of volume in them. And then additionally, if we need to address lower abdomen or the arms, that can be 1 or 2 procedures as well. How far this procedure should be apart, again, all depends on your overall fitness level, volume of the liposuction, comorbidities. In some instances, can be a few days apart to allow your body to recover, to replenish those electrolytes, and make sure that you stay adequately hydrated. Or if you're not in rush and you want to take it easy on your body, it can be as far apart as you want. It can be several months, years, but at least 6 to 8 weeks will give you a sufficient amount of time to pretty much fully recover from the first liposuction procedure. Another question I commonly get asked, what area to do first, and that all depends on your symptoms and the desires. As I said, if lower legs bother you the most, and that's where you experience the most symptoms, we can start with that area. If your thighs give you the most trouble, when you want to start with that, that can also be done. If you want to do your arms first, that's also a possibility. There is no right or wrong answer. You can kind of mix and match and see what fits your goals. I hope you found this video helpful. Please click the like button and subscribe below.